right, guys, we are live. We are super excited to be here tonight with you. It's March 20th, and it's crazy to think that we're already almost done with March. But we have special guests with us tonight, Dr. Sofia. We are super excited to have you on tonight and to talk about you and your practice. And, we are just so blessed to be able to be in relationship with you and have you taking care of some of our clients and vice versa. So tonight is all about you being able to just kind of showcase what you do, who you are, and just the amazing benefits of the natural health care that you bring to Tampa Bay. So I'm going to go ahead and I'm going to turn it over to you. I'm going to let you introduce yourself, and we'll just start rocking from there.
Well, thank you very much for having me. So I am a board certified acupuncturist and herbalist that I specialize in mainly chronic pain and sexual health. So that's anything from gynecological irregular periods to large fibroids or even ED. I see a lot of men in my clinic, but those are my two kind of big specialties, even though I do cover a wide range of other issues, like anything gastrointestinal. Acupuncture is very good for anxiety, depression. I work great with. And I guess how I got started into acupuncture was kind of by accident. I was graduating USF trying to figure out what I wanted to do next. And I had gone through a bunch of different avenues like chiropractic, PT, even looking into natural medicine. And someone had suggested acupuncture. And I was just like, I'm petrified of needles. I actually don't know. Started doing a little bit more research, went to a few schools, and I landed on East West College of Natural Medicine, and they let me sit in on a treatment. And what had happened during that treatment absolutely just blew my mind. I was like, wait, what happened here? I need to find out more. And ever since then, I've just been full gung-ho with acupuncture.
That's awesome. And just for those of you out there who are watching this, watching the replay, Dr. Sofia, can you just kind of explain where you're located at in Tampa so people just kind of know, because you have multiple locations, correct?
Yes. So my main office is in Oldsmar, right on Racetrack and Hillsborough. And then the second office, I'm only there on Fridays. It's at Tampa Bay ChiroCare, and I'm there from 10 to 5 p.m. We're soon, hopefully, having a few more days open to the public.
That's awesome. Yes. Lots of locations is good, right? Because obviously the goal with obviously the holistic network is to be able to provide care for people all over Tampa Bay. And as you know, people in Tampa, they don't necessarily love to drive very far. So having exposable areas where you can hit multiple locations is just super, super awesome. So, well, we are going to jump into some questions. And the first question is really what would you say was kind of the main driver? And I know you just kind of briefly shared, but like looking at your career where you're at today, what was or what is kind of the current status of what inspires you to be in the field of more holistic health with acupuncture, sexual wellness? What's kind of your driving force there?
It's interesting. So my father is a physician, and I grew up with him as an amazing role model. He's just so good with his patients. And, I was the little one constantly tagging along. I had a little lab coat. I would see patients with him in the hospital. And it always kind of pushed me towards that. I think where acupuncture and traditional Chinese medicine comes in, it just takes on a whole other beast. I mean, I get so intimate and personal with my patients. I go through everything, not just the body, but the mind and the spirit. And I found that I really loved holding space for people to just feel whatever that was, whether that was their successes, their failures, their pain. Just being able to see them, hear them, understand them, and have them feel that back was always my main driver. If I wasn't an acupuncturist, I would have been a psychologist, but here I
That's
am, all of that all in one.
that's awesome. So I think that that's really important because even for like the clients that we see too, the holding the space part is really important because there is so many different layers to these problems that they're struggling with, and like you're saying, a psychologist, we almost act as a secondary psychologist to a lot of them, right? And so understanding like where they have been and what they've tried and how it all kind of intermingles with each other, but then trying to unwrap those problems with, some sort of game plan and plan of action to start to really leave that behind and start to navigate through that and kind of piece it all together. The harmony of that is really, really, really important. So um I love that you shared that, the psychology part, because oh man, that is so true. So um with the industry that you're into, obviously acupuncture, we are trying to move a different route than obviously like Western med, right?
Yeah.
Um, how does your industry and what you're doing and some of the procedures and treatments that you do, how is that trending? Like what are the major trends right now that you're seeing in the healthcare space as far as that goes?
So I would say a lot of my patients, because we have that intimate relationship, I am doing a lot of backtracking for a lot of other doctors. So my patients come to me, they're either this is like their last ditch effort, or they're fully into acupuncture and they've been introduced and they're totally with it. But the ones that are kind of backtracking a little bit and I have to kind of work uphill for, um, a lot of the times they just don't feel heard. I have to explain what their previous doctors have explained to them. They don't really understand their treatments. They don't understand why they're on 2 pages of medications. And I have to go through each and every step. So we look at their lifestyle, their diet, um, their mental and emotional state during injuries or post. And I guess, sorry, I just kind of lost my thought there.
You're
But yeah, I guess the biggest trends are just hearing them, listening to them, and changing the way that their brain is perceiving those patterns and behaviors. Back pain could be a significant structural issue, or it could be a reoccurrence of a particular emotion, or they're sitting for too long, they're standing for too long, they're doing too many things. I feel like a lot of people's mind and body are just not connected. And we go through life in that default mode of pushing everything to the side. And um, it acupuncture is very, very confrontational in a way. And it's very vulnerable to have somebody poke a bunch of needles in you and engage a very visceral physical response. Um, but ESTEM is very great at treating anxiety and depression. Wet cupping is great for those with like hemochromatosis, anemia disorders, any kind of other blood disorders. Um, Auricular acupuncture I use very often for smoking cessation. And I also just started doing facial rejuvenation acupuncture, which is just to help the face, nourish the face, help with discoloration, help build collagen. And it's also just another diagnostic tool that we use.
Yeah, I got a question from a lady, Deb. Thanks for your question. She asked, "Can you explain a little bit more about acupuncture?" You talked about the needles, and so for people who are definitely afraid of needles, who don't want any type of medical procedure, of obviously having been in the medical model, I'm sure, Deb, that's where your questions come from. How can you really help them feel comfortable and walk them through? And what should they expect if they were to undergo some acupuncture for the first time? What can they expect?
Yeah, so the initial consultation, the whole thing is about an hour and a half. The first part, we're just going through your entire medical history. I'm asking you a bunch of very it would seem random questions, but they all start to make sense as the bigger picture starts to form. But the acupuncture needles are so, so thin. I mean, you could fill a balloon, stick an acupuncture needle in it, and it won't pop. They're as thin as a hair. I could tie them in a knot, and you hardly feel anything. They say about 80% of people cannot feel the needling sensation, maybe just the needle insertion, but the sensation that you feel afterwards, like a heaviness, a tingling, a numbness, those are not frequently felt. So most people just kind of feel pretty relaxed. But there are times where you can have like sweating or feeling out of body, floating, melting. Those are all natural. It's just the body kind of expressing what's been holding in. So after we've done your intake, I would start kind of like palpating all around the body. I'm going to go from head to toe, poking around, seeing and finding active points. These are these reactive points in which you're going to feel either sharp pain, a dull pain. It might feel good when I press on it. What I'm looking for are little divots or foramen or excesses. So, like, there's going to be little bumps that come up or little divots that go down. And based on where those are and what they kind of elicit when I press on them, will tell me which channels in the body that we need to work on. So, kind of backtracking a little bit, there's about 14 different meridians in the body that all connect with your nervous system, your circulatory system, your muscular system. And each of the acupuncture points are eliciting a response from all of those systems. So, after we do the assessment with the palpation, we'll start sticking in the needles. I'll let you sit on the table for anywhere between 25 and 45 minutes. Now, why that varies is because when I stick a needle in, we're waiting for the chi or chi to arise. This is the vital force that kind of animates us. It's in us. It's creating all these chemical processes in our body. And the body will tell us that it's stimulated correctly when we get that redness. Now, we'll let that redness dissipate completely to the needle point, and then that's when the needle is ready to be taken out. So some sessions you'll sit on the table for 20 minutes, sometimes you'll sit for 45. It just depends on how your body is receiving the acupuncture that day. And after the acupuncture treatment, I personally like to follow up with cupping and a hot stone massage. So we'll increase the blood flow all along the back or anywhere you have pain. And then I'll finish off with a nice relaxing hot stone massage to resettle the nervous system.
That sounds wonderful.
It's a
uh,
pampering experience. And I
I was
also
going
always
to say,
give my patients customized herbal tinctures or teas. I make a herbal blend specifically to your condition so that each treatment is actually better supported by the herbal tea that I give. And it also gives some of my patients an excuse to drink the water that they need to drink and
yep.
take herbs regularly because it's tough to get them to take their herbs regularly.
And we know how big of a part the nutritional side of things is with this, right?
Yeah.
And so I love that you talk about the meridians and how important that is. And hopefully, Deb, that answers your question too, because that was great. I learned a lot there. The meridians are so important, right? And so I think a lot of people overlook those and how powerful they can be when they're definitely not in sync, right? And so when we talked about, how what we do at Navigate versus what you're doing, and how some of the things are very similar in a sense, like the non-invasive stem cell therapy, right? We've talked about that before. That's all off of meridians too, and we know how patients respond just so much quicker when those are just synced and everything's in alignment and everything is working so much just more cohesive. So um, thank you for that explanation. That was very helpful for sure. So like I said, guys, if you guys have questions, make sure you guys post those below so we can answer those throughout the live here. Um, what would you say is the biggest challenge right now, whether it's in your business or whether it's just in the world of healthcare as you see it? Clearly, we know there's a massive shift in natural health. People
Yeah.
want out of the traditional medical model. And there's amazing doctors. I mean, we have tons of amazing doctors in Tampa, but I think a lot of people are starting to really wake up to say, hey, like, we want something more proactive. We want to be, in charge of our health and not wait until it's so far gone to now start addressing it. What would you say are some of the challenges, though, you're seeing in your practice or in healthcare when it comes to the clients that you're seeing? What challenges would you say?
I think the biggest one would be consistency. So I get a lot of patients, like I've said before, at the end of their rope. They're coming to me as a last ditch effort. They've put in so much already. And to go to another physician and have another physician tell them it's going to take at least 10 treatments or more to resolve this issue, they get very, very, it's disheartening. They're like, oh, this is going to be even longer. But consistency is key. I mean, some people respond right away, right off the table. Others, it takes them a while because, and what I found are the ones that are the most difficult are the ones who've used their diagnosis as their identity, or they've kind of merged their identity and their illness together. And that's when we start to disconnect. We start to dehumanize ourselves. We start to make poor choices. Um, and I think that's where a lot of people go wrong. Like acupuncture should be the first line of defense. Go to it when you don't need it. So it doesn't have to be that much of an uphill battle. Um, it's just it works so well. And we don't even have to that. um, like I don't even have to treat an area of pain. Let's just say you have lateral epicondylitis. I don't even have to put needles in this shoulder to treat that shoulder. We can do herbs. We can do opposite arm acupuncture. I could do your ears. We could do reflexology on your foot. I could do moxotherapy. There are so many things that we can do outside of just like the regular acupuncture to treat these conditions.
So many options. And I thought what you said there was really, really spot on because there are so many people who get diagnosed with something and they just let that label across them. And then they restructure their whole entire lifestyle around that, right? And so they stop doing things that they need to do because they feel like it could potentially cause more problems. And it's just like, what are we doing? Like, no, like you need to increase your exercise. You need to increase your awareness on your nutritional side of it. So I love that saying because it's something that we preach really, really heavily in our office too. It's just we're not going to define you by a diagnosis. What actually we say is labels are for cans, not for people. And
Yeah.
and I love that because people resonate with it, right? They're that's like, yeah, like I'm not just gonna, I shouldn't let this dictate the future. I just need to figure out how to co-manage it, right?
Yeah.
And so love that, love that, love that. Okay, um, I guess my question for you is how do you, when you look at people who are kind of interested in your services and your treatments, how do you figure out who you want to work with and who you don't want to work with?
That is an ever evolving concept. Typically, when I give the treatment plan up front and what it's going to entail, these are lifestyle changes. These are not small, minute things. And if they're unwilling, just they fight me tooth and nail on drinking more water. They fight me tooth and nail that they don't want to stop drinking alcohol on the weekends, or just adding some vegetables, different colored vegetables into their routine. I know that this probably isn't going to be the path for them. Um, and those who are truly invested will continue with the treatments, and they'll be committed, and they'll be ready to take on those challenges.
Yeah, you're very similar to myself. Like we have to protect our energy too, right?
Yeah.
Because there's so many people out there that need our help, and some want the help. Some really do, and those are going to be what we consider those amazing ideal clients. And there's going to be people who want our time and our information, but they just can't manage to take the next step and create the action steps. And so, um, I love how you answered that because it's kind of it's an application process, right? Um,
Mhm.
these clients are coming to us because they know what we do works and they are looking for a better way. Unfortunately, we are two docs in a world of many, and we would love to see everybody. I think that's every doctor's goal coming out of school is I'm going to save the world and we're going to help so many people, and we do, but we forget that there's just so many moving pieces with that puzzle. And at the end of the day, we can do our best to help them, but we cannot do more for them if they're not willing to make those changes, like you mentioned, and start again putting effort forward for themselves. And I tell my team this, I tell my wife this all the time. It's just like, somebody came in, they were looking for help. It's just like the help's right in front of them, but they just weren't ready. And
Yeah.
that's tough because you know that you can help them. And I'm sure that you've had cases and clients like that as well. So,
Oh, it's been a learning process for sure. Especially for a person like me. I'm a bleeding heart. Like, you tell me something, I'm going to do everything in my power to try and help you. And I also think it's really important for physicians to take care of themselves, and really give time throughout the day to take breaks, to not overwork yourself. I mean, I've seen my father to this day get at least 3 hours of sleep, and he's a sleep specialist just because he's constantly catching up on charting. He's either working at the hospital or coming back to the office and finishing patients. And I vowed, I was like, nope, this is that. I can see how that wears and tears at a person, and it'll wear down your compassion, and it'll wear down your patience. And sometimes those really difficult patients just need a little bit of patience and love. And so it's been a learning curve because I still try. I still try and help those people kind of change. But sometimes, I got to know my own limitations and just leave it to them.
oh man, isn't that the truth? Yes, yes. We love everybody. Unfortunately, we just can't help everybody at the same time. So, um, when you look at like the way that the changes are coming, obviously, like I've been mentioning, how do you see your field of work specifically, acupuncture and kind of the sexual wellness? How do you see that? Do you see that ever getting to a place where, and I know this answer, but I want the other viewers to kind of learn this. Do you see there ever being a decline in what you're currently seeing now with some of the sexual health stuff? And then obviously some of more of the what we've talked about more recently is more of those chronic disease patterns. Um, where do you see those trends going? And then how do you play a bigger role in more of that natural remedy for those?
I like this question. So this is in the sexual health space. I mean, I see so many people struggling with fertility, for struggling with their menopause, irregular periods. Their doctors are saying these signs and symptoms are normal, and it just isn't. I think acupuncture and natural medicine is going to be a big game changer in those fields, in these areas. Um, and with all the new advancements, it's just going to keep getting bigger. I mean, I don't know how many patients I've explained pelvic floor therapy to, and they were just completely blown away, or, exercising their Kegels appropriately and how to do that in a way that you're not actually injuring yourself,
Yeah.
or, how small little habits can change the course of endometriosis for a patient experiencing really severe, heavy periods, a lot of clotting, a lot of pain, and how that can go away in a very quick amount of time with Chinese herbal therapy and acupuncture. So I think that my field is not going away anytime soon, and I think it's only going to get better and better able to infiltrate these spaces and help those patients.
Yeah, I mean, we look at just kind of what's going on in the world. And obviously, if you've been struggling with some of the things that Dr. Sophia has been talking about, I highly recommend you guys schedule a time to talk and get together. Um, we look at the way that obviously, men, erectile dysfunction, prostate problems, right? Women, yes, fertility. We're seeing obviously a higher increase in, you know, from
Constipation,
yes,
or which one
everything.
one and the same.
There's so many things, and so, um, but like I had mentioned earlier, I think so many people have just kind of been stuck trusting just the medical model, right? Of take this medication or do this procedure, and I think people are tapping out on it. I really do. From the conversations that I've had, so many people are just like, I'm just sick and tired of being sick and tired and doing the same things and trying the same meds, and you know whether it's a 30-year stint of birth control, whatever it may be, right? Because we know that those long-term repetitive traumas to the body are going to carry their weight. And so again, if we're not getting rid of that stuff and starting to allow the body to heal naturally, then are we really ever going to get to the root cause of a lot of the substance that these people are carrying around?
Yeah,
Probably not, right? And so it's really hard to have some of those conversations, and sometimes it's really uncomfortable too. But we need to have those more than ever right now because the way that the world is, people are lost and they need answers. And I think that you specifically are just so well versed in these type of problems that you have so many resources to give. But again, there's only one of you, and so that's the hard part, right?
yeah,
Um, because I can tell too, you've got a giving heart, just like we do, obviously. Um, but again, there's so many people that need your help, and there's also people who just don't know where to turn. Right? They
yeah.
know that they need the help, they just don't know who to go to, or they haven't found the person that's the right fit for them. So, um, if somebody wants to get into contact with you and they're watching this and they've got some more questions, just kind of talk about like next steps. Is it something that they can do like a consult with you, or what does that process look like?
I do free 15-minute consults on the phone. If you have any questions, my website is www.linaeast.com or linaeastacupuncture.com. Sorry about that. Or call me on my phone number. The office number is 727-946-1814. But yeah, just backtracking to what you said a little bit earlier. Patients just kind of being fed up. I think it's because Western medicine follows such a strict protocol, and a lot of physicians are practicing defensive medicine because they have such standardized care, whereas acupuncture, chiropractic, other things are more personalized and completely individualized. So every single patient that comes to me gets their own individualized treatment. Nothing is repeated, nothing is, there's not one model that fits all.
I think that's important, and I agree with you there because I actually speak to this when I do other seminars too. Is the worst thing that we can do is just do the cookie cutter things and expect everybody to get the same results, right? That is the furthest thing from the truth. So I love that you do that. Obviously, we knew that you were doing that, taking care of some of our patients and doing phenomenal work. So I love what you do. Um, Let me see if I have any other questions here. I have some statements. Um, will you be opening an office in Lakeland anytime soon?
No, not currently, but the future plans are to join forces with Tampa Bay Chirocare, as I'm doing now, and open a facility in Brandon. And
Okay.
that facility will be rebranded, but hopefully within the next couple of years, we could get that program started and running.
It's awesome. Sorry, Renee, that's not going to happen. But you can catch her in Brandon. It sounds like in a few years. So, um, if I don't have any more questions, that's what I have for you. It's been an honor to be able to jump on with you tonight.
Thank
I don't want to take up too much of your time because I know you have busy, long days. So I want to give you some peace of mind and give you some rest as well because we definitely need that. So it doesn't look like I have anything else coming in right now. You guys can catch this replay. Make sure you connect with Dr. Sophia. If you guys have any questions, we obviously have her contact information too, so we can get you paired up with her. Do a free 15-minute consultation with her just to connect and see if this might be a good fit. And we would love to help her continue to grow and expand her business all throughout Tampa Bay. So we thank you guys for being on tonight. Dr. Sophia, again, thank you so much. And
you.
blessings, and we'll be talking soon.